Hello, and welcome to the 2016-17 National School-Based Healthcare Census. This brief tutorial provides a demo of the Census data portal. The objectives of this tutorial are to describe what is the National School-Based Healthcare Census, to provide a demo of the data portal and how to complete the survey for multiple school-based healthcare programs at the same time, and to provide contact information for how you can reach out to us for additional help. So first, what is the National School-Based Healthcare Census? Since 1985, a survey has been completed that has asked all school-based health centers across the country to share information about important characteristics, including their location, staffing models, services provided, population served, and funding sources. The data that's been collected through the census is vital to demonstrating the breadth and impact of SBHCs nationwide. They're used constantly for advocacy and convey the hard work that school-based healthcare programs do every day. For the 2016-17 census of school-based healthcare programs, the Alliance is partnering with an experienced survey research firm based here in Washington, D.C. called National Research, LLC. We want to let you know, as you're getting started, that you can contact National Research at the following number or email address to get support in helping you to complete the survey. You can call them by phone at 202-686-9350, and please ask for Anthony Kincaid, or by email at survey@nationalres.com. So now I'd like to provide a demo of the Census data portal. Once you log in, you'll be taken to a page that looks like this and asked to select your state and the lead sponsoring organization. I'm going to provide a tutorial now using fictitious information, but to help you to get a sense of the different functions of the data portal and the types of information that you'll be asked to provide as a part of the census. So I'm going to pretend that I'm a school-based health care administrator in Colorado, and that I'm completing the census for 3 school-based health centers sponsored by the Metro Community Provider Network. I'll click on these 2 options, and let's say I didn't see my sponsoring agency in this list. Click here on Search Your State's SBHCs to identify your lead sponsoring organization, and then hit Submit. First, you'll be asked to share and update contact information for the lead sponsoring organization and share information about funding sources for your school-based healthcare programs. So in this instance, these school-based healthcare programs are funded by state government, patient fees, public and private insurance, as well as private foundation dollars. Next, I'll be asked to share information about the types of services provided by the lead sponsoring organization and other agencies. As you'll see in this first table, I'll be asked to provide information about the services provided by Metro Community Provider Network. It's a federally qualified health center that provides administration, behavioral health, oral health, physical health, and vision services for the school-based healthcare program. Next, let's say I want to share information about another organization. Sunrise Community Health is a federally qualified health center that provides behavioral health services for our school-based healthcare programs. And we partner with the Boys and Girls Club of America a nonprofit community-based organization for youth development programs. Add as many lines as you need in order to add all of the agencies providing services for the school-based healthcare program. Next, you'll be taken to a page where you're asked to select the names of the school-based healthcare programs for which you'll be completing the census. I'll be completing the survey for all 3 school-based healthcare programs. Note that you have the opportunity here to mark a site as closed, as well as the opportunity to edit the contact information for a particular school-based health center. This is the main menu for the 2016-17 census. This is the completion tracker. So a few important things to note. First, you'll note a column called section status where you'll see green, red, and yellow squares. Completed sections will light up green. Yellow means you're in progress. Red indicates that a section hasn't been started. Please note that you can save and return to your survey at any point. Finally, when you've completed all sections for a school-based healthcare program, you'll see a submit button at the bottom of this page. When you hit submit, your census will be complete. As you can see, we completed the information about the lead sponsoring organization, including contact information, funding sources, and information about the agencies providing services. Next, you'll see this list of the 3 school-based healthcare programs which I selected for which I would be completing the survey. If I want to add more sites to this section, I click on Add More Sites, and I'm given the opportunity to add additional sites. In the third table, you'll see the 8 components of the census survey: schools served by the programs, demographics, operations, staffing and services, telemedicine, health information technology, client and visit data, and an optional section to tell a story about your school-based healthcare program. I want to start with a section which will ask you to describe the schools served by the school-based healthcare program. Click on Begin section and you'll be taken to this page where you'll be asked to select the schools served by the school-based health center. When you click on this button, first you'll be asked to select your school district. I'm going to select Jefferson County School District number R-1, and then I'll be taken to a list of all of the schools in that district. If the school-based healthcare program serves all schools in the district, click here. Otherwise, click on the names of the schools served by the program. And hit Submit. As you can see, they've been added to this school. You'll do the same for the other 2 programs. Again, I'm going to select Jefferson County School District. Select the names of the schools and scroll to the bottom to hit Submit. And I'll do the same for Jefferson Kids and Teen Clinic. If I select Save and Home, it'll take me back to the main completion page, the completion tracker, and showing me in yellow that I'm in progress because I still need to completely finish adding the schools for the 3rd school-based healthcare program. These other sections ask for you to share information that you'll be familiar with had you completed a survey in the past. For example, is your school-based healthcare program a school-based health center? In other words, fixed on a school campus, a school-linked healthcare program, which is a fixed site near the school campus, or a mobile program. Finally, you'll have the option to select whether or not the program is a 100% telemedicine program, meaning that 100% of services are provided using telemedicine technology. I've selected that the first two are school-based health centers, and that the third program is a 100% telemedicine program. As I come back to my main page, I want to show you that if you select that 100% of services are provided by telemedicine technology, you'll be asked to share information with a special set of 8 questions for that health center. So you'll be asked, are telemedicine clients seen by appointment or drop-in and walk-in, as well as a series of another 7 questions. This optional section asks you to tell your story. If you come to this section, you'll be asked to describe factors that are encouraging or discouraging growth of the school-based healthcare programs in your area, how youth, parents, caregivers, teachers, and school administrators are being engaged, and how the school-based healthcare program is providing adolescent-centered, culturally sensitive care. With your permission, we'll use these stories to highlight them in our census report to convey the incredible work that school-based healthcare programs are doing every day. As I mentioned, once you complete each section in this survey, a submit button will appear. All these boxes will be green. We ask that you click on that button and your census will be complete. If you have questions, we would like to encourage you to contact us at census@sbhforall.org. We will be in touch with you as soon as we can with a response to your question. And if you want to reach out directly to National Research and ask for support, again, on the screen are the contact details for our colleagues with whom we're partnering to do this work. Thank you for participating in this tutorial, and if you have any additional questions, please reach out to us. Thank you.